Why is abscess drainage needed for diverticulitis infection? Imagine a small pocket in your colon becoming inflamed and infected. Sometimes, this pocket can fill with pus, creating a pocket of infected fluid called an abscess. When this happens during diverticulitis, draining that abscess becomes crucial. The reason is that antibiotics alone often can't fully clear the infection if the abscess is large. Removing the infected fluid helps control the infection locally, preventing it from spreading to other parts of the body. Abscesses form because the inflamed diverticula, which are small pouches in the colon wall, can trap bacteria and pus. If the abscess is small, less than about 3 centimeters, doctors might treat it with antibiotics and watchful waiting. But if the abscess grows larger, over 3 to 4 centimeters, drainage is usually needed. Larger abscesses pose a higher risk of complications like spreading infection or even causing a serious condition called sepsis, which can be life-threatening. The most common way to drain an abscess is through a procedure called percutaneous abscess drainage. This is a minimally invasive process guided by imaging techniques like computed tomography or ultrasound. A thin needle or catheter is inserted through the skin directly into the abscess. The infected fluid is then aspirated or continuously drained out. This method helps reduce the infection quickly, often avoiding the need for open surgery, which can be more invasive and carry higher risks. While abscess drainage is very effective, it does have some risks. These include the possibility of the abscess coming back, complications from the catheter, or infection spreading if not managed properly. That's why careful patient selection, proper catheter care, and close follow-up are essential for a good outcome. In some cases, even after successful drainage and antibiotics, doctors might recommend elective surgery later on. This could involve removing part of the colon to prevent future flare-ups or recurrence of abscesses, especially if the abscess was large or if the patient has repeated episodes. In summary, abscess drainage is needed in diverticulitis infections mainly to remove infected fluid that antibiotics alone cannot resolve, especially when the abscess is larger than 3 centimeters. It helps control the infection locally, relieves symptoms, and speeds up recovery. It also reduces the need for emergency surgery and can serve as a bridge to planned, definitive treatment. Always remember, if you suspect diverticulitis or an abscess, consult a healthcare professional for personalized care.